Hi everybody, my name is Tasha Penny and I am a program manager at the Registered Nurses Association of Ontario. And for the next 15-20 minutes or so, I am going to be providing an overview of the learning plan for the ACPF program. Before I begin though, I want to say if you have any information about ACPF, please contact Erica D'Souza. She is the project coordinator for the ACPF program. Now, I've done some past webinars on ACPF that are archived on our website. So if you're looking for more information about the key elements of ACPF, the eligibility requirements for participation, information on the types of fellowships that we offer, and the application review and selection process, please watch one of these webinars. And I would suggest that you watch the webinars I have done some previous webinars on the ACPF program. So if you are looking for more information on the key elements of ACPF, the eligibility requirements for participation, and more information on our 4 types of fellowships, as well as the application review and selection process, please watch our archived webinars on the ACPF webpage. So the main purpose of this presentation is to go over the critical elements within the learning plan to help you understand what it is we're looking for specifically. And then finally, I'll go over our proposal review process again, just briefly, and then finally answer any questions you may have. And if you are, listening to this as an archived webinar, again, please contact Erica D'Souza for any questions. So ACPF stands for Advanced Clinical Practice Fellowship, and it's RNAO's fellowship program, which really has 3 main benefits. First, it allows for a unique opportunity for registered nurses and nurse practitioners in Ontario to meet a specific learning need with their organization as well as RNAO support. It fosters a nurse mentoring opportunity because one of the main criteria for this fellowship is that the applicant has to have a mentor that works really closely with them. And finally, it helps the nurses organization or the fellows organization improve patient care by way of educational, development of that fellow, which, hopefully spreads to the nursing staff. So, as I mentioned, there are 4 types of fellowships, and this is addressed more in a previous webinar. But just to recap, within the ACPF fellowship, there are 3 skill development streams. So the clinical, leadership, and best practice guideline implementation streams. And then our new fellowship, the AMS RNAO fellowship, has 3 core themes, and the applicant interested in the AMS fellowship chooses one of the core themes. So let me just get into a little bit about the proposal. So I've added the link at the bottom of this slide where you can go to download the proposal. And just so you're aware, the ACPF skill development streams, they have their one proposal in RFP, but the AMS RNAO fellowship has a separate proposal in RFP because the questions are just slightly different due to the focus. So just please be aware that you're downloading the correct proposal depending on what stream you're interested in. So the proposal is quite lengthy. It's a very comprehensive description of what your proposed learning goal and plan is. And it does outline what the fellow, the mentor, and the sponsor organization's responsibilities are in terms of the activities within the fellowship program. And really the proposal should help RNAO and external reviewers have a really clear understanding of what the fellowship goals, activities, and outcomes are. So on this slide, I just wanted to show what the breakdown of the proposal was. There are 7 sections, and each section has a percentage worth. So as you can see here, the learning plan is worth the most at 40%, which is why we decided that it was worth having a webinar dedicated specifically to the learning plan, which I will now get into. So again, probably the learning plan is one of the most important sections of your proposal. It's, again, worth 40% of the overall evaluation. So some tips that I would suggest right off the bat is to develop your learning plan with your mentor. I wouldn't suggest trying to tackle this on your own, but include those who are going to be part of your fellowship experience. Definitely obtain input from your organization. So this would be particularly your direct manager. And then make sure that the learning activities and goals that you're identifying are realistic in terms of being able to accomplish them within the 450-hour time frame of the ACPF fellowship. So now I'm going to go through the specific sections of the learning plan as outlined in this table. And this is also in the RFP and proposal if you're interested in seeing this. So I'm going to start with that first column there. And that's, sorry, so now I'm going to go through the specific areas of the learning plan as outlined in this table, starting with stating your learning goal, which really is what do you want to learn through this fellowship? I've highlighted learn here because really that's the focus of the fellowship. I also want to stress that your learning goals should be consistent throughout your proposal, and it should be consistent with the skill development stream you have chosen or the core theme if you have picked the AMS fellowship. Again, your learning goals should be clearly identified in the abstract, consistent throughout the whole body of the proposal, and should be specifically linked to a need or gap within your organization. Also, I want to say here that it should be linked to short-term and long-term outcomes, and you are asked specifically in the proposal, what the short-term and long-term outcomes of your fellowship will be. So I wanted to give you examples throughout this presentation that will help you kind of put this all together. So I've looked at a past proposal that we received that was very successful, and I've implemented it throughout this presentation. So this fellow, the learning goal that they stated was to increase my knowledge and expertise related to ICD deactivation for patients who are near the end of life. So throughout the rest of this presentation, this is the learning goal that I want you to keep in mind. Now, in terms of sort of the checklist of whether this fellow met, the skill development stream they identified was the leadership stream, and specifically the education foci within leadership. And then in terms of the need or gap in service, within their proposal, they highlighted that, with the number of patients with ICDs on the rise, that healthcare providers will be increasingly confronted with ICD deactivation requests for patients near end of life. And then the fellow summarized it by saying, currently there are no practice guidelines available in their organization to assist healthcare providers who are caring for this type of patient population. So when the fellow was outlining what the short and long-term goals are, short-term, they wanted to draft a guideline that will be used within the unit that this fellow worked in. And then the long-term goal was, of course, improve quality end of life, and then reducing the incidence of painful shock at end of life for these ICD patients. So hopefully you can see here how nicely the learning goal meets the criteria from the previous slide. Again, I'm really just going to reiterate here with respect to the learning goal that consistency is critical. Okay, so after you have identified and finalized your learning goal, you'll need to develop the learning objectives. So your learning objectives should support the achievement of your learning goal, and again, they should also be learning focused. I would suggest that if you're new to developing learning objectives, that you follow the SMART mnemonic. So an objective that follows SMART is more likely to succeed because it's specific, so you know exactly what needs to be achieved. You can tell when the objective has been achieved because you have a way to measure completion. So I'll just quickly go over, the five circles here. So specific, that's the first circle we'll look at. An objective that is specific is detailed, focused, and clearly stated. And everyone reading the objectives should know exactly what it is that you're trying to do. In terms of measurable goal is quantifiable, meaning you can see results. It should be achievable, so that means that it's realistically can be attained based on whatever your skill, resources, and area of practice is. And it should be realistic. So again, a realistic goal applies to your current nursing role and practice and linked to your key role responsibilities. In terms of time, an objective should have specific timelines and a deadline. And all of these should be met throughout the learning plan, because pretty much each column within the learning plan will ask you to identify how you're going to measure and the time frame and so on. So I would suggest Googling SMART if it's been a while since you've applied this mnemonic. There are a lot of great resources out there on this. So since I keep emphasizing that your learning goal and learning objectives need to be learning focused, I figured I would share with you some keywords we have seen in applications that are learning focused and have been successful. So I've highlighted the keywords in orange here. So, to increase knowledge, increase skills, build on current knowledge skills, to learn, to understand, to improve existing knowledge, and again, to learn. Okay, so going back to the example, our learning goal example, so to increase my knowledge and expertise related to ICD deactivation for patients near end of life, I wanted to show you the learning objectives that are linked to this learning goal. So what I want to really say here is your objectives should logically build on one another to meet that short-term outcome that you've identified in the application. So if you remember, one of this fellow's short-term goals of the fellowship was to draft a guideline on this topic specifically for the nursing staff on their unit. So if you look at the learning objectives here, first the fellow was going to build on their current knowledge of the activation of ICDs at end of life. And then after they built some more knowledge, they wanted to understand what policies and processes exist already within healthcare organizations, so to gain more of an understanding of how other healthcare organizations are tackling this, and then finally to learn how to develop a guideline on this topic specifically. So these objectives really follow logical order and build on one another. Now that you've developed your objectives, you'll need to identify the resources and strategies that will help you to meet the objective. Your resources and strategies should be clearly linked to your outcomes, which I'll describe a little later in this presentation. So I also really want to say here to really think about the number of objectives that you're identifying in your learning plan, because every single objective will probably have about, let's say about 4 or so strategies to meet that objective. So in terms of making sure that your learning plan is realistic in terms of time frame, please consider the amount of objectives that you have. So when you're thinking about, the strategies and resources to meet your objectives, again, select a variety of ways that you're going to meet that learning objective. Involve your mentors or your mentoring team in determining if the strategies make sense and will be effective. And then for each strategy, you're going to be expected to identify which mentor will be involved in helping you fulfill that strategy. We really recommend that you seek learning opportunities external to your organization for a broader perspective. And one of the things you can do is actually attend conferences or events that are relevant to your learning goal. Again, go back to the literature while preparing your proposal, because within the literature you might find some strategies. And then make sure the strategies that you're identifying in your learning plan are consistent with what you're describing in your proposal, as well as the budget. So your budget's going to ask you to account for each one of these strategies in terms of costs. So some examples of resources and strategies that we've seen in past proposals, I've listed here. So just very quickly, you can attend a Best Practice Champions workshop. So that's through our NAO. RNAO's BPG implementation toolkit might be very helpful if you've picked the BPG stream. Conduct a literature review, search or review, attend conferences, arrange shadowing experiences, review policy and procedures within your organization or others. You can connect with subject matter experts, and then conduct site visits to other organizations. So these are just some popular strategies that we've seen. And again, just want to reiterate here that you're really going to want to make sure that all these activities that you're identifying is realistic in terms of the 450 hours of your fellowship. So I'm going to take one of the objectives outlined on slide 18 and focus on it for the purpose of this presentation. So this is a good time to, again, to ask you to be mindful of the number of objectives that you're putting in your learning plan. And to make sure that, it's realistic. So the learning objective I want to focus on now for this example was the applicant's first objective, and that was build my current knowledge on deactivation of ICDs at end of life. So similar to objectives, your strategy should follow a logical order that builds on one another. So I'll just read these out. So for this objective, the fellow stated that they were going to meet with their primary mentor for an educational session on how to go about developing a search strategy, prepare a draft literature search, and obtain feedback from their mentorship team, and then, of course, perform the search. And then this fellow was also interested in reviewing, the level of evidence or the quality of each study. And then finally, to synthesize that evidence that they retrieved. So as you can see here, this is a very logical order that will tie into the outcome of this objective. So in terms of the outcomes in your learning plan, they should really, let readers know how you will know or demonstrate that the learning objective has been met. So each learning objective has an outcome connected to it. The outcome should be clear, measurable, and then linked to other aspects of the learning plan, and should logically flow from the strategies and resources. And of course, very important that the outcomes can actually be evaluated. So really, this section, answers how will I know I've achieved the objective, and what will I have to show for it. I would suggest that when you're filling out the outcome section of the learning plan, that you phrase it as the following: as a result of meeting this objective and using these strategies, I will. So there's some examples here. I will develop a documentation tool, produce an annotated bibliography, a policy, a lunch and learn, and so on. So again, just want to really emphasize that your outcomes should be specific and concrete as possible, because you're going to be asked to evaluate them. All right, so now I want to link the outcome to the resource and strategies from our previous example. So remember, our fellow was interested in building on their current knowledge on deactivation of ICDs at end of life. And then they identified the strategies and resources they were going to use to do so. And the outcome tied to this particular objective was to develop a literature review on deactivation of ICDs at end of life. Okay, so you're going to be asked to set target dates for all of these activities that you're proposing. So you're going to be asked when you're going to start the fellowship and what the completion date is. You should indicate whether you're doing it full-time or part-time. And then please, plan for any holidays or vacation that may come up. And that's your holidays and vacation, and as well as your mentor and mentoring team. Keep in mind and what needs to happen first in terms of your objectives, as well as the strategies that go along with those objectives. Be realistic about how long some of these activities will take. And then in terms of how you're going to show target dates, you can organize them on the number, so what week it will fall in terms of completion and the date. And I do have an example of that in this slide here. So going back to our example, of ICD at end of life. So the outcomes, the three major outcomes this fellow had identified was to develop a literature review, and we looked at that example. They also wanted to complete a written plan for process of guideline development, and then finally to draft a guideline that may possibly be used on their unit. So even you can see here the outcomes actually follow a very logical order. So then in terms of the target dates within the learning plan, the fellow identified what week. So let's say they're doing it full time, there's 12 weeks. They identified what week it would be completed in with a specific date. Okay, so this brings me to one of the most important parts of the learning plan, and this is how are you going to evaluate it? And this section, I will say, is where people lose most marks. So again, you have any questions, do not hesitate to contact Erica, or, you know, access your mentors or anyone else who might be really used to evaluation activities. So in terms of evaluation, consider, you know, what is the basis for determining that you successfully met your objective? How well did you meet the outcomes? Who will provide the feedback on your learning outcomes? So which mentor? And then what method or criteria will be used to evaluate? Some examples of evaluation has been written feedback from the mentor or the team, self-evaluation through reflective journaling, so that's the fellow self-reflecting, and then any feedback if you've you know, developed a workshop or any types of tools, some actual written feedback from people who may have been using it. So just to give you some example of how to go about doing that. So going back to our example, if you remember, the outcome was to develop a literature review on deactivation of ICDs at end-of-life care. So this fellow, in terms of evaluating this outcome, they stated, the literature review will be reviewed by my primary mentor and evaluated for completeness, clarity, and relevance to the topic. My primary mentor will provide this in written feedback form. So this answers, you know, what is the basis for determining that they've met the objective, and that's the literature review. You know, how they're going to accomplish this outcome, so that will be, you know, a complete, clearly written and relevant literature review. They identified the who, so who's going to be doing the evaluation, and then they identified the criteria that this person will use, and the criteria in this example is whether the review is complete, clear, and relevant to the topic. And then the method is the written feedback. Okay, so this brings me to the last column of the learning plan, and this is where you will track your progress. So when you do submit your proposal to RNAO, this section is of course left blank because you haven't started the fellowship yet. But we do suggest that you use it as a tool to track your progress throughout the fellowship. You should be updating this on an ongoing basis, and at the end of the fellowship, you'll be expected to update and complete this when you submit your final report to RNAO. So let's tie this all together using the proposal example that I've been referring to in this presentation. So the objective, remember, was build upon my current knowledge on deactivation of ICDs at end-of-life care. And then the resources and strategies listed here ended up with this individual learning on how to undergo a literature search and then synthesizing the evidence, with the result being, or the outcome being, a literature review on this particular topic. They identified the target data when they would complete this literature review, and then of course how it was going to be evaluated. So this is a really nice example of how, you know, a successful learning plan looks. And if you remember, this individual actually had 3 objectives. So there'd be 3 tables similar to this. So just to recap on how we review our proposals, each proposal goes to an external review committee and is reviewed by at least 2 to 3 individuals. The individual evaluation is followed by a subgroup evaluation to determine consensus, so that when we receive the final score of the proposal, that everyone was in agreement. And then in terms of post review, we provide very detailed feedback on all proposals. And even if your proposal has been accepted, please expect to have to do some minor revisions before funding is released and before you begin your fellowship. And then for those applications that have been declined, we do provide detailed feedback about what was missing or areas that can be strengthened. So with that as a template, you should be successful the next time around. And so we really encourage that you try again for future cycles. And you can always contact Erica to talk about your proposal if you're just looking for more information. So I'm going to, in the next few slides, provide you with some proposal writing tips. So make sure that your learning goal and the activities you want to do is congruent with your organizational goals, that you're consistent about throughout your proposal and what it is you're going to do, that you follow the format and the template provided through the RFP. And again, here I'll stress that the RFP is probably one of the greatest resources that you can use to make sure your proposal is successful. Ensure your scope is appropriate within the time frame, write in the first person. And again, make sure your fellowship is based on your learning goals, not project-based. So use learning verbs when you are writing your learning goals and objectives. Really important, don't assume that us at RNAO or the external reviewers know anything about you or your patient population or your organization. So be very clear about who you are, your mentors, and your organization throughout the proposal. So, explain things like you're speaking to a complete stranger. Be very clear what you will be learning and what the outcomes are for patients, the staff, and the organization. And you'll be asked specifically about these anticipated short-term and long-term outcomes, as I indicated earlier in this presentation. And then please do not develop this proposal all on your own. Make sure that you are receiving feedback from your mentor or senior management within your organization. So, and make sure everyone else has had a read over before you send it to us to make sure everything sounds really good. Okay, so if you're interested in applying, please attend our live workshops or access our archived webinars for more information about ACPF if needed. We always encourage that you, ask potential mentors or people from your sponsor organization if they're looking for more information. They are welcome to attend the workshops. Please check RNAO's events calendar for any upcoming workshops. Thank you.